Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Female with complaints of ovulation. If female has complaints of ovulation, there are two things.
If female is complaining of anovulation, then there are two things. It is anovulation.
One, there can be no corpus luteum, that is reduced or absent progesterone leading to amenorrhea. Or second, hormone present is estrogen, and this estrogen will proliferate the endometrium, thus leading to shedding of weak endometrium, that is estrogen breakthrough bleeding will occur. Whenever there is estrogen, breakthrough bleeding can occur on any day. In estrogen, breakthrough bleeding can occur on any day, leading to anovulatory cycles, thus causing irregular, painless, and heavy bleeding. Normal menstrual cycle.
Then this female with anovulation, there is no corpus luteum, so there is decreased or absent progesterone, so this will result in amenorrhea. And hormone present is estrogen is present. This proliferates the endometrium, leading to weak endometrium, and this weak endometrium will result in estrogen breakdown bleeding.
thank you and thank you for watching.